Welcome to the edition of the DAMY vlog. My name is Dr. David Duizer. Thank you so much for tuning in. On this show, we talk about all things holistic health and wellness related. If you like that topic, please share so we can spread the message. This is my first time using the YouTube Live feature, so please bear with me. I'm going to do my best to facilitate this discussion through this means. I don't know if I can switch between links on my computer or not, so just bear with me. It's my first go. Today on the show, we're talking about heavy metal testing and chelation. I don't do much of this in my practice, but I'm deeply interested in using it as part of the holistic approach to chronic disease management, because that's what I do. People come to me when they've been through the conventional system and they're looking for other ideas to help them feel and perform better. And reduce their risk of mortality, reduce their risk of complications, reduce the risk of medication side effects. That's what we do here. So sometimes heavy metals, environmental exposures, these come into play. We know that heavy metals are toxic to our cells, just like we know that other environmental exposures are toxic, like BPAs and phthalates and things like chemicals in the environment, like Roundup and pesticides like this. So they're bad for us, period. Removing them is probably better. The question is, to what extent is removing them better? In my practice, I do everything possible to practice evidence-based, integrative, and functional medicine, focusing on evidence-informed principles. And in doing so, it's easy to see that heavy metals can be toxic. Individual metals can be individually toxic, can be specifically toxic to certain cells. For example, we know that lead and cadmium are hard on the cardiovascular system. They are definitely bad for us in terms of how our arteries function, how our heart functions. It's been well documented. We know that mercury is bad for the nerves. It's bad for the brain. This has been well documented. So this information is available. The question is, and the problem has been that clinical trials have not shown to what extent benefit you can achieve by removing these toxicities from the body. There isn't even a consensus really on testing. So what do we do here in this clinic? Well, like I said, this is not a first-line therapy. This is a way to apply the holistic approach to chronic disease management after you've been through the set of conventional steps that need to take place in a diagnosis or in a symptom profile. So, for example, if you have an autoimmune disease, the first step is not doing heavy metal testing. The first step is suppressing your inflammation so you're at less risk of significant symptom profile from that disease, less risk of complications of that disease. Then as you transition to say, okay, why is this happening? How can I reduce the negative effects of this disease long term? Then we can look at things like environmental exposure, including heavy metals, as one component of that. So you can see that it takes me a long time to get to let's test heavy metals, and therefore we don't end up doing it very much. When we do it, here's how it goes. In our clinic, we have access to all types of heavy metal testing, including blood, urine, and hair analysis. The way they're used is as follows. Blood is used to test acute exposures. Like if you know you've been exposed to mercury, you need a blood test. And that blood test can be eye-opening. We've had to call poison control a few times in the clinic here, and I've gotten to know how to handle acute mercury toxicity pretty well. The second approach is hair analysis. In our clinic, we use a professional functional lab that tests hair. Hair is a pretty good way of assessing multiple minerals on both the essential mineral side and the toxic mineral side. Hair analysis is good for many of these minerals, but what's important and what's interesting to know is the relationship between healthy and toxic minerals in the hair. And the functional lab that we use uses the Dr. Andy Cutler approach to assess the relationship between heavy metals in the hair and the distribution of minerals in the body. And in using this approximation, it has been eye-opening. It has been completely eye-opening because it's a very inexpensive and easy test to complete, as opposed to the urine assessments. And therefore, people can just do it, once every few years to know what their level of exposure has been. The tricky thing with the hair test, for every centimeter of hair that's assessed, that represents about a 1 month of exposure of heavy metals. So we typically do 3 centimeters of hair, and we approximate the exposure over 3 months. So that's nice to do as well. On the urine side of things, a pre-provocation urine is just a first morning urine. that basically tells you what you've been exposed to in 3 or 4 days prior to the test. Unless you have osteoporosis and you're leaching heavy metals into your bloodstream all the time, then the urine test can be a good expression of your chronic exposure. But without osteoporosis, it's basically what you've been exposed to in the last 3 or 4 days. And then sometimes, in very specific cases, we'll do a provocation assessment. Provocation assessment is where you do that pre-urine test, then you take a sulfur-based compound, and then you do a post-provocation assessment where you collect urine for a few hours and see what the sulfur was able to pull from your body into the urine. And that's a good thing. That's a good thing to do in chronic disease. But that's a last approach. That's if we really need to know total body burden. And there are some cases where that's helpful. So that's my clinical approach here in terms of heavy metal testing. We have access to all three. I do a lot of hair assessments. We see people coming in with blood assessments already done, and they want to just get a snapshot of their 3 months exposure. Hair assessments are good for that. But then because my practice is so complex and I see a lot of very difficult cases, we do end up doing some provocation assessments once in a while. And they can be helpful as well in certain circumstances. So that's how we assess, but what do we do now? Our training in heavy metal assessment, or my personal training, was based on the TAC1 trial. The TAC1 trial is the trial for assessing chelation therapy that was done a few years ago by Dr. Lamaze. And this trial showed that in diabetics who have cardiovascular disease, who have had a cardiovascular event, an MI or a heart attack, their risk of a follow-up cardiovascular event is reduced if they do chelation, specifically for diabetics. It didn't show much impact on other populations. If you didn't have diabetes, it didn't seem to do much. And when I see chelation in this state, I mean IV EDTA chelation that pulls heavy metals from the body, not a therapy that I do much of. But this therapy has been done for a very long time. It's well documented that it pulls lead from the tissues and as well cadmium, I believe. And so EDTA chelation is a cumbersome IV. It's like 3-hour IV that you have to do 40 weeks in a row. It's a lot of work. But what they were able to show in this trial was that for diabetics, it reduced their risk of a cardiovascular event significantly. Now, what was interesting about TAC1 for diabetics was that it didn't actually have any impact on blood sugar control. It did not change glycemic scores. So fasting blood sugar was the same. But the risk of heart attack was reduced by 40 or 50%. It was amazing. The risk of all-cause mortality was reduced by 38 or 40%. Just amazing results. Really, really, really great results for this chelation study. So what happened? Well, the NIH said, let's fund it again. Let's do a bigger trial and focus directly on diabetics who have already had a heart attack. And let's get lots and lots of patients and let's repeat this and quantify it. It showed the first trial showed that it was safe and it was effective for diabetics, so let's redo it. Now, what was wrong with the first trial is what's important. And they note this in their paper. What was wrong with the first trial was that they didn't actually test for heavy metals. So they went through this process of, let's take this group of people, not just diabetics, lots and lots of people. Let's do chelation and see if their cardiovascular risk goes down and their all-cause mortality, their risk of death goes down. And geez, it didn't do much for the general population, but it did lots for diabetics. Now, how would that have changed if they had tested heavy metals prior to this? If they could then quantify for the people who had really, really high lead levels, really, really high cadmium levels, would that have made it more effective for people who did not have diabetes? Who knows? It's probable, but we're not really sure. All we know is that without testing, it worked for diabetics. So in this second trial, they're going to be testing heavy metals. And I believe they're also going to be testing markers of oxidative stress and markers of inflammation, because there's a hypothesis going around that it was the inflammation that was reduced, or it was the oxidative stress that was reduced, and that's why it only worked in diabetics. So anyways, that seems like it'll be done in TAC2, the second trial. And I'm doing everything I can to be involved with this because I'm incredibly interested in integrative medicine research and naturopathic type research, because I want to move this profession forward and I want to move this way of healing forward. If this could be a way of healing that's accepted in a conventional setting, you could see EDTA clinics set up for diabetics all over North America with the direct purpose of reducing cardiovascular events. And who knows? The patients didn't have blood sugar control changes on the EDTA chelation? What if they were able to practice a naturopathic approach? Okay, so now we have groups of people who we know have high heavy metal exposure. We can reduce their blood sugar through diet. We can get them off of medications. We can replace medications with natural products that work just as well. At the same time, we can do 40 chelations. Then what? Then the reduced cardiovascular disease could be reduced. The reduction in cardiovascular risk could be even more pronounced. From my perspective, we're making a career in this clinic out of taking people off of diabetic medications by helping reset their blood sugar. And what if chelation was simply part of that process? So now we have, functionally, how can we improve your blood sugar through diet and exercise? And then, okay, let's look at your cardiovascular risk and decrease it on another level. Only if you have high lead, high cadmium, then we can do this other therapy, and boom, your cardiovascular risk could be dramatically reduced. And here is the percentage chance of reduction based on this very large trial. So that will be very, very exciting. I hope it turns out really well. I'm excited about TAC2. I don't really have anything else to share about that. I think that it's really important to note that there is research being done in these different areas of holistic approach. This one specifically about environmental exposure. Toxins from the environment are bad for us, and we need to avoid them. If you have unexplained symptoms, if you have never been able to find out why you're feeling the way you're feeling, if you feel awful and you can't figure it out, see a naturopathic doctor and look for someone who's evidence informed, evidence based, and allow them to guide you through this way of assessing through the conventional side and say, here's what we can pick up functionally from your conventional tests that you've already had done, and here's what we can do moving forward in these areas, whether it be sleep, stress, hormones, toxicities. What can we pick up from these different areas to help improve your life moving forward and reduce your symptoms? Like, let's actually get people feeling good at the same time as looking for causal relationships. And if we can treat the cause, then we're really rolling. So let's say that in diabetics, potentially the cause of one of the factors that increases cardiovascular risk is lead exposure. Well, from this trial, we'll be able to quantify that, and we'll be able to say, okay, what if we reduce it? Then what? And if we reduce it and the risk of cardiovascular event is significantly suppressed again, boom, now we're onto something, and now we have major clinics opening up all over for this direct purpose. Or we have diabetic clinics that add this in. They have a room where all they do is chelation therapy, or maybe even easier chelation therapy will be more appropriate. Something with capsules or something that's not a 3-hour IV, for example. Who knows? But that will be the future of patient-specific medicine. That would be the future of this, looking at an individual person and saying, how can we reduce your risk specifically, not just using population studies, So anyways, it's really, really exciting, and that's what I'm passionate about. The holistic approach to health and wellness is everything, and individualized care is transforming medicine, and I love being on the forefront of that. I'm trying to get involved in TAC2 as much as possible. I'm looking for people who I can screen and get involved in the study because I want it to be done. I want it to be already rolling. So I'm trying to screen patients as quickly as I can. So if you're someone who has diabetes and has already had a cardiovascular event, who has already had a heart attack, and it's been documented. So you've had a heart attack, diagnosed with diabetes, you can Google TAC2, or you can call me personally, or you can email me, and I can help you get involved in the trial. If you're interested, I think it will be interesting for people to get involved because it's moving integrative medicine, functional medicine, naturopathic medicine forward, and we need more of this. So thanks for listening to my little rant here. I'm passionate about this. I think heavy metals are bad for us. I think they need to be removed if they're in there. I just don't know. I can't quantify the effect of symptom reduction and disease reduction after we remove them. So this trial will help. I'm being quite I'm being a bit selfish on this front. I want my patients to have this, so I want this trial to get going. So thanks for listening to my rant, and we'll see you next time. If you like integrative wellness, if you're interested in holistic approaches to chronic disease management, please subscribe to this channel. Hit the bell so you get notified if I do live stuff more often. But again, I'm really grateful for you tuning in. I'm really grateful for you subscribing. I just really like talking about this kind of thing. So thanks for watching. If you're interested in learning more, Google Tact 2. Look through Tact 1 as well and see what you think of it. Thanks for watching and have a great day.